All right, welcome back, everybody. Tonight, we're going to talk to Andy. Andy lives in Canada, and we're going to discuss the healthcare system there. Andy, I hope it's okay to discuss your wife's position also in Canada. She works in the healthcare industry as well. I don't know if you want to start off by letting know listeners what's happening, viewers, what's happening with your wife's situation. Is that too personal to ask?
No, not at all. Yeah, I'll let you in on it here. My wife is known as a scrub nurse or in the OR of the local hospital. She's been doing that for 25 years. On the Sunday, they called her to tell her she was being deployed in the screening area of the main entrance of the hospital. Now, it's interesting to note that my wife's typical outfit is what you would see the current healthcare providers wearing when they're dealing with coronavirus patients, which is the mask, the face shield, the hat, the cover, and whatever else they have for them. But my wife wears that every day. So it wasn't a big deal for her to have to wear that stuff and do that job. Now, this was just at the very beginnings of when things were happening. So they weren't dealing with a lot of people. They certainly weren't dealing with any sick people at that point, because it's still fairly new in Canada. And so she was able to stay in our house. I have been social distancing and basically in my home for almost 3 weeks now, only leaving once to go put some gas in my truck. But the week after that first initial week of screening, she was back into the OR and working with doing her regular job on an afternoon shift. And they had changed up quite a bit of the procedures for them in the OR, because I guess they're most exposed to the sputum of the patients during intubation and extubation, and which is when you put the breathing tube in before you put a patient to sleep before surgery. And so it was such a profound risk that the only two people that are allowed into the room while this is happening is your anesthetist, or I guess Americans would call him an anesthesiologist, and a circulating nurse. Everybody else in the room had to leave because of the dangers. And these two people were in their full PPE for protection. Well, she did that in the afternoon, and she's been worried about the situation, right? She's worried that she's the only one leaving our house and coming back home. And is she bringing the virus home to us? And so we had some long discussions trying to figure out what we did. And I ended up going to a place where my trailer is stored for the winter and getting it out early and putting it in the driveway, setting it up and running power to it and getting the propane tanks all filled. And as of this afternoon, when my wife got home from work, she is now going to be living in the trailer without any direct contact with myself or my daughter or the two dogs. And she won't step back in this house until the crisis is over. So
Wow.
It's been a pretty emotional couple of days for us. It was too much for her to think about the fact that she could be the reason why we would all get sick. So now, granted, it's a nice big 30-foot travel trailer with all the amenities. It's got a microwave in it and all that stuff. And I consider us lucky that we have that, because, with all the healthcare professionals, what do they do if they don't, right? I mean, you can try to isolate yourself in a different part of the house, but ultimately you're still sharing the same place with a single, heating or cooling system, right? That's blowing the air everywhere.
So has the patient load at that current hospital changed? Has the environment changed there over time, or is it still sort of, fairly static? Is it a rise, or,
Well, we don't have nearly as many confirmed cases of coronavirus in Canada as they do in the United States. To his credit, our Prime Minister got right on this right away, and you know, announced the stimulus packages that were coming to assure people that it was okay to go and stay in their homes. And we, of course, you know, like any society, we still have our goofs running around thinking that there's nothing wrong and everybody is overreacting. But for the most part, and especially my group of friends, the people I know, my mother who's still alive, and we are all, you know, doing the social distancing thing and washing our hands consistently and doing all that stuff, right? So when my wife started in the screening area, there weren't any known COVID-19 cases yet.
Do you
And
know the date? You know the date of that when the screening started? Do you remember the date?
it would have been 3 weeks ago. It would have been 3 weeks ago Monday. And so since then, we have 20 patients that are current residents in that hospital. Our numbers nationwide are about 7,500 confirmed cases. Now, I always tell people, and I've always heard experts say that when you know those numbers, those are confirmed by a test, right? And they're only giving tests to people under certain conditions, right? And my wife informed me that they're only people that have been out of the country in the last 2 weeks are ones that are eligible for having the coronavirus test. So if you haven't, then they won't give you the test. And if you're not in respiratory distress or in any danger of any kind, they send you home and say, you know, boost your immune system, do this, try this, and see if you get better. If it gets really bad, if you find yourself it's hard to breathe, then come back to the hospital and we'll admit you, right? And so that number is deceiving in all countries, right? That of the confirmed cases, because I'm
Right.
sure the larger number are people that haven't had the test, right? There might be, you know, the confirmed cases currently in the U.S. is about 163,000, but you know, that could be upwards of 1 million people right now. It's just they've only tested 163,000 of them, right?
And I think the larger political question, as you know, Italy has been hit pretty hard, and
Yes.
they have a single payer system in Italy. So people are saying, well, look, see, they have a single payer and the country is a mess. Now, Canada has universal health care. Is that what it's
Yes.
called there?
Yes. Yes.
And I'm just curious, you know, because obviously people would say, wow, COVID-19, there's going to be an overrun. Everybody's going to run to the hospitals because everybody here in America who pushes back says that in Canada, these long waiting lists. And so people are probably looking and hoping that, you know, your system would turn out to be like Italy, but that's not the case at all. Do you think that the universal healthcare system that you have played a role in this?
Well, I would say yes, but I would say for the better. There are things that people aren't being told about Italy, and two very important factors in the Italy problem was that the Italian population is quite an aged population compared to others in the world. And so,
Second in the world.
yes, and I think that we were still learning a lot about it, and people weren't prepared for it. Clearly, our governments weren't prepared for this. If they'd taken the information they got from China back in January when this had started there, they would, you know, have gotten ready for this. They would have put these programs in place beforehand. But you know, the neoliberal society, so a false scarcity that we live in. Oh, we can't afford this. We can't afford to spend extra money on our healthcare system. Well, now your economies are in danger of collapsing. Your people are dying by the, you know, tens of thousands. How's that working out for you, right? So, anyways, my back to your question, the Canadian system is of free healthcare. It doesn't do anything for you if you're exposed to the virus. Like anywhere in the world, If you're
Except
adult,
for
right?
except for it takes away the fear of the cost. So if I'm not feeling well, as you told me off air, I'm going to the doctors without maybe just my health card. I'm going
Yes,
there knowing that when I go to the doctors, if I'm hospitalized, everything is covered.
absolutely. I can go to have anything done in the medical industry in Canada and never have to take my wallet. As long as I am a citizen of this country, or a resident, a permanent resident of this country, and I have a healthcare card in my pocket, then I can go to any hospital or any doctor or specialist if I'm referred, and it is all completely free of charge. There's no negotiating with insurance companies. There's no having to ration medicines. It's the cost part of it is taken away. You can concentrate on getting better instead of worrying about how am I going to pay for this, right? And that's a huge thing in people's recoveries. It's hard enough getting sick with something as debilitating like this, or cancer, or any disease, right? And the pressures and the thing that goes along with that, it's all, on top of worrying about if you can afford it, if your family's not going to go bankrupt because you got sick.
Now, how long has Canada have had universal health care?
I believe it's been since the 60s,
And
1960s.
the big question that everybody's going to ask is, how do you pay for it?
Well, let me tell you, um, the government pays for healthcare in Canada the same way it pays for everything, the same way any sovereign nation with its own, which is a monopoly issuer of its own currency does, right? They basically just mark up the accounts of the different bank entities that they require to do things and spend the money in. It's no different than and how the military, is paid for, how all social security things are paid for, how the Canadian baby bonus is paid for. Our friend Christina informed us that if you have a child in Canada, right, you're eligible to receive a child care benefit, and it's a yearly amount that's mailed to all parents of young children up to the age of, I believe it's 18.
On top of your free health
On
care.
top of our free healthcare, yes.
So but even though you have free health care and there's no fear of medical bankruptcy in Canada,
Right.
you did also have to have a stimulus package by your Prime Minister Trudeau, right? So
That's correct.
how do you feel, again, you can cover two topics here. How do you feel the package was for as far as the crisis is concerned? And again, how is Canada going to pay for this?
Well, we've got a number of different initiatives that were announced, and I believe that the total amount in the latest one is $82 billion of spending for a stimulus package. And when I say that amount of money, that might not sound like a lot to Americans, but you have to remember that Canada is 1/10 of the population, right? So we only have 1/10 of the number of people that have to have money spent on them. But it's a pretty comprehensive package when you look at it. We have a instantly anyone that's working can apply for insurance benefits, for unemployment insurance benefits. And if you aren't working, or you aren't eligible for those for employment insurance, there is a special benefits plan that allows someone that is working, lost their job, but doesn't qualify, or someone that is taking care of someone that is sick with the virus, which is a $900 amount of money every 2 weeks for the first 15 weeks of this.
When it comes to MMT, what are some of the limits of the social programs up in Canada, and how do you see MMT being used in Canada to help maybe run things differently in Canada, which seems like it's running fairly well up there, but what do you see as maybe some of the issues that could be addressed?
Well, we're suffering from the same neoliberalism virus, as I like to call it, in Canada as we do it in the U.S. The government still like to, portray a false sense of scarcity like they do in the U.S., right? So Canadians are still way overtaxed than they need to be, right? We are constantly told that our hospitals or our educations have to cut back because there isn't enough money, there isn't enough taxpayer money in the system to pay for it. And we know damn well that that's not the way that it works, is that if you want to defund education in this country, it's a political choice. It's not a financial one. And that's the same with every reason, right? Like, I mean, why do we need the Cancer Society to raise money from its people? And it's infuriating once you start to have an understanding of MMT as how unnecessary all those taxes are, right? Like, I mean, the government provisions itself by creating a tax. It drives demand for that currency by having a single tax on people. But we have a government that will, put a tax on our income, our property, all the things we buy in society. If you buy a vehicle, you pay tax on it. If you sell it to somebody else, they have to pay tax on it. Like, I mean, it's all of those taxes that are basically just removing money from society that don't do anything, that are completely unnecessary. And on top of that, in the United States, you don't get health care, right? So you've got all these taxes that you have to pay, and you have to pay for your health care. If we understood and we can show people that these are realities in economic society, that MMT is real, it's the way that money's been done since the early 70s and before that, when Nixon took us off the gold standard, right? And it's extremely important. I think that our world is not going to be able to deny the fact that the United States government is sinking $1 trillion into the stock market on a daily basis for a month. That would pay for universal health care in the United States for 10 years. There's a lot more regulations on our banks. That's why our banking system didn't crash in 08, 09 when the American one did. That's why the big three automakers in Canada, because they're subsidiaries of the big three in the US, that's why the Canadian of the big three were able to stay liquid, and they didn't have to declare bankruptcy. It was only the American segments of those corporations that did. So Canada's a little more, a little wiser when it comes to spending and reining in unfettered capitalism than it is, unfortunately, in the US. And I see it daily in my interactions with my American friends that I do activism with, and the pain and suffering that they unfortunately go through on a daily basis.
Well, that's why, in here in America, obviously now we have this pandemic, and it's shining a light on the need for childcare. It's shining a light for the need for free college education. So I don't know, when people run for office in your country, I mean, we have Bernie who's running for office and asking for all these things, and then of course people ask, how is Bernie going to pay for it? Do you get that same pushback when people run for office in your country?
Our media is as corporately owned as the American media, right? And we get a lot of the American media in Canada just because of the sheer size of the US compared to our own country. So that's an issue as well. And there's a lot of pushback. a lot of the, I would say a lot of the older people in the countries vote in elections like they cheer for a sports team. They've got their favorite. It doesn't matter what they do or how bad they might be getting screwed by that party. They're a party guy, through and through, you know. And it's unfortunate. And I think that a lot of people have lost the ability to even think critically about their own situations and how it might be changed for the better. I remember having a conversation in a live stream with a lady from Texas who said that I was wrong, that progressives and liberals were just bleeding hearts and nobody deserved free stuff. And my response to her was, well, don't you think that we should all live and have a better life, that that there shouldn't be suffering? And her response to me was, no, we all suffer. That's just the way it is. That we're meant to suffer. That's the only way that we can go through life. Like this system of government that that's, you know, prevalent in our society occurs naturally in nature, right? So there are better ways we can do that. We have to look at our societies under an MMT lens and realize that there's always money to be spent. I think that when this crisis is over, the world is going to be a very different place, right?
But also in Canada, when elections come up and you have now Prime Minister Trudeau, I mean, you see what they're doing to Bernie now, a guy whose economic advisor is Stephanie Kelton and who believes in MMT. Is there any chance, are there any movements in Canada that gives you hope in that country that any change we made, will a pandemic open the eyes of Canadians to other choices?
I don't know if it will, just because I don't think that Canadians are suffering as badly as Americans are. I would like to think it was. When I was evaluating what I wanted to do as an activist and I learned about MMT, I originally started to try to reach out to different groups in Canada, and quite honestly, there was very little even organized. And then that's when when I found Real Progressives and started working with them 15 months ago. So, but I also believe that the United States is such a huge player in the world as far as policy and a leader in so many things, even with the current environment, that if the change can happen in the US, it will be a domino effect throughout the world. And so I thought that if I decided I was going to do some activism, I should do my part here to try to make the changes, because we don't have a lot of time left if we want to save human beings' ability to live on this planet. Now, as far as Canada is concerned, they're still not talking about it. And I have good friends that have run and been elected members of parliament in the Canadian government that have run for the NDP, but even those people aren't even yet talking about MMT. So it's not even really been discussing. My hope is that, you know, once this election cycle is over, I would like to reach out to like-minded people in my own country and see if I can start a movement here. I know there is a Democratic Socialists of Canada group that I've been looking at and maybe seeing if I might join them, but definitely if there is an organization in Canada, I'd absolutely love to be a part
So
of it.
what would you say to someone who's in Canada? What would some of the problems would MMT solve in Canada? What still needed to be solved by MMT in Canada?
Well, we have a lot of the same problems the US does. They're just not to the same degree, I would say. Like, I mean, there's certainly, the healthcare system is always underfunded. Why in a just society would you underfund your healthcare system? Why would you, in a just society, underfund your education system? Your children are your most valuable asset, your most cherish possessions? Why would you want them to start their lives with the best possible way, right? There's so many different things in our society that understanding it through an MMT lens will instantly make better. We can guarantee a job to everyone in the country. We can eliminate homelessness. We can properly fund mental health. There's just so many different things that we can do. We can create, do you know how much empty space there is in this country? Do you know how many solar farms we could power the world with all the empty space in Western Canada, you know?
So you bring up a great point. So some of the stress, you know, one of the issues that no one's talking about that we were going to talk about tonight is mental health, right? So all these people in America are under great stress for so many different reasons. You can take me for an example. Since you opened up personally, I will tell you that rent is due on April 1st, that I don't think I can pay the full amount. My own tenant, I'm a landlord, hasn't been paying her rent. You know, I have workers who don't want to come into work because they are afraid they're going to get sick. I work in New York City, the epicenter. So my wife is obviously very scared every time that I come home that she has a lowered immune system due to a medical condition. So the stress level. Now, I have health insurance, but I would much prefer, because just if I have, believe it or not, I have social anxiety, I would much prefer to talk to a psychiatrist or a psychologist through telemedicine. I don't want to have to go out and go to the doctor and come back.
Right.
And I don't want to have to worry about the cost or how many times a week I'm going to have to speak to her, or if she decides that she's going to put me on a drug, what the cost of that drug is. So again, all these issues are playing out in America, but you know, everything is being a bright light is being shown on all these issues. So I would love to speak to a psychologist or a psychiatrist, either or, you know, and not have to worry about the cost, and have it done in such a format as this, and then it would make it much easier for me. So again, you would hope, you know, with MMT, people would understand that all of this can be paid for.
Well, and if our government spent properly into society, the money side of this wouldn't be an issue. There wouldn't have to be. All people would have to do is worry about their families and themselves and their neighbors staying safe. Stay at home. The government can always use the power of the purse to bail out whatever aspect of society they need to, without any problems, without any penalties at all, right? You can bail out the stock market. They're showing that, right? None of the American government, the American federal government, had a problem with giving $500 billion to corporations, right? This last week, while they gave a few crumbs to the people.
And you bring up a great point, because here in America, we don't even know how far this goes as far as unemployment concerned. We're giving numbers right now that we might end up having 30% of the American population unemployed. Now, I don't know what the numbers are projected where you are.
Right.
But again, those numbers cause stress. Those numbers make people freak out, because how do we pay our bills? How do we put food on the table? I mean, the stress of, you know, like I said, in your country, I mean, we have a bit of a child benefit now because of this one stimulus package. I think we're all getting one, you know, if however many children you have, you're getting some sort of payment. But again, we don't know how long those payments are going to take, right? So
exactly,
it's also the waiting period puts stress on all these people. And I live in an area where the crime rate could increase, or just the agitation. People could have nervous breakdowns. You're going to have people drinking more, doing more drugs, whatever is their coping mechanism, correct?
Right, right.
Because
exactly.
they can't reach out to a psychologist to speak to them because it costs money, and they don't have, and they, you know, the stigma, you know, even with mental illness, the stigma of mental illness, and now the cost, oh my God, I have to pay for this. So again, these are just other issues that aren't even really on the table here in America. Everybody will talk, oh gosh, what do psychologists and psychiatrists say? Well, none of them say, hey, we should have Medicare for all so people can access it. it's not brought up. So I mean,
Exactly.
your health insurance, it covers what? Does it cover dental? Does it cover what Bernie is talking about hearing aids and dental and obviously mental
We have,
illness?
our system is for basic health care as a right. It doesn't include sight, so glasses. It doesn't
Glasses, thank you.
include dental. It doesn't include elective surgeries like plastic surgeries and those kind of things. And it also doesn't include prescriptions. However, the cost of our prescriptions are a lot more reasonable than they are in the United States, right? And so, but the vast majority of Canadians who work in full-time jobs get those extra covers through their work, right? So you would be maybe out of pocket a little bit for those other things, which aren't too bad, but for the most part, most people have drug plans with their employers, and so they are taken care of, right? But there's certainly no reason. There's certainly no reason why, in a just society like we were talking about, that all of those other things couldn't be covered as a right to the people as well, right? Because we know that the government can never run out of money. And so if they choose to spend on the people, there's no reason for anything that Bernie Sanders has proposed to not be able to be implemented. Right.
And that's why I brought it up, Andy, because I figure if I can sharpen your platform, maybe
Yeah.
you can become the Bernie Sanders of Canada.
Okay, but I've still got to get, if I look in the mirror over there, my hair's not quite white enough yet, but I could do it. It's like the top 1%. How was that? Was that not bad?
That was pretty good. You're
okay.
You're
All right.
halfway.
I'll work on it. I'll work on it.
Halfway there. Well, I wish you the best. I thank you for coming on and shedding some light on your personal situation and on the healthcare system in Canada. Maybe next time we can have a psychologist come on and we can discuss our stress levels.
Well,
together.
I might just know one that we could.
All right. Well, maybe next time.
I'll invite her.
Thanks again, Andy.
Problem. Thank you, Matt. Take care.
Good night, everybody.